My name is Samuel Jan and I work for Dr. Kwesi Debra in the Center for Cosmetic Surgery. In a very short moment, you're going to listen to Dr. Kwesi Debra in an interview as he explains how he restores the beauty and the youthfulness of his patients. Before then, I'd like to tell you about my personal story, about how I came to work with the man Dr. Kwesi Debra, one of the world's finest cosmetic surgeons and gynecologists. My wife was unfortunately shot in a robbery incident when she got her face disfigured, and somebody recommended Dr. Kwesi Debra to me. We loved the result of his work, so I decided to help him to spread and to advertise the good job that he's been doing here at the Center for Cosmetic Surgery. I don't want to run too much. Just listen to Dr. Kwesi Debra in this short interview as he explains how safe the procedure is, how he can help you to restore your beauty back, how he can help you to get a firm and a strong and healthy body with nice curves. Listen to Dr. Kwesi Debra.
Greetings, folks. This is Orlo Furi. Today we're here with Dr. Kwesi Debra of Center for Cosmetic Surgery, Ghana, and here in Maryland, USA, Aesthetic Laser and Vein Center. He's the founder of these institutions, and he is himself a cosmetic surgeon. Welcome to the African Dream, Dr. Debra.
Oh, thank you, Ora.
It's a pleasure to have you here.
Oh, yes, I'm very, very happy.
So, you are a cosmetic surgeon.
Yes.
What inspired you to become a cosmetic surgeon?
Well, basically, probably starts with some stuff that I maybe picked up from my dad.
Okay.
Dad is, passed away, but he's a sculptor. So, I have an eye for beauty. I have an eye for, fine stuff.
Right.
And, my patients kept requesting procedures from me when I did gynecologic surgery. And, I started thinking about it. And I watched a few YouTube videos and then decided that it's time for me to get into it, because cosmetic surgery really it's not just the knowledge, but your ability, innate ability to be an artist, to be a sculptor, to be able to sculpture people and get their bodies right. That is really what it entails in cosmetic surgery.
Huh. Interesting.
Yes.
We'll delve more into that as we, progress in this interview. Let's go back to where you're from in Ghana. Where did you study in Ghana?
Well, I did my medical school in Kumasi, School of Medical Sciences, Kwame Nkrumah University of Science and Technology.
Right.
And these were the formative years of that institution, of that medical school, because that's the second medical school they started. And then when I completed, I came over to the U.S. and went to Howard University Teaching Hospital.
In Washington, D.C.?
Yes.
Right.
And then, are you familiar with it? Are you?
Right.
Okay. So those were the years. I started Howard University in transitional medicine. That is, I did rotation in medicine, general surgery, obstetrics and gynecology. And eventually I settled for obstetrics and gynecology.
Mm. So how long had you practiced in obstetrics and gynecology till you felt the urge to amalgamate cosmetic surgery as well?
About 10 years.
Mm.
About 10 years I did obstetrics and gynecology, and then I realized that I've had a lot of experience in obstetrics and gynecology, especially with gynecology, doing surgery for women.
Right.
Then I decided that let me get another area of medicine under my belt, because it's an open field there. What you needed to achieve is to enhance beauty, with cosmetic surgery, and you. So I did some courses. I did some mentorship with some of the renowned cosmetic surgeons, and after a while I realized that it was time for me to
fly out there and be on your own.
hang my shingle, as they say.
I know, right? Interesting.
Yes.
So What are your, like basic areas of focus as far as being a cosmetic surgeon is concerned?
The main area for me is body sculpting, and so folks come to me and they have fat in different areas that they've been trying to work out and they can't get rid of. They come to me, and that's where we start. And so I do liposuction with different modalities. I use laser, I use the power assisted method, I use the water, I use Vaser. These are all different techniques or different tools to do liposuction. But at the end of the day, you're trying to achieve a well
sculpted figure.
Yes, and so that's really the area that I focus a lot more. But I'm able also to do fat transfer. So I take fat from one area, and the ladies want Brazilian butt lift.
Right.
So we transfer the fat to their hips, to their butt, and we enhance their figure. And we even transfer fat to the breast, and that also enhances their figure. And of course, when people have sagging skin, we're able to do tummy tucks. That is, after we've done the liposuction, there's excess skin, so we go ahead and remove the excess skin, and that's what they call the tummy tuck. We also do liposuction of the arms. Sometimes people have the second part of their arm that's waving. We take care of that. And quite recently, with my background in gynecology, a lot of women come, they want vaginal rejuvenation. They've gone through menopause, or they finished having their kids, and the vagina is not the same again. And so we use laser. We now have different types of laser that we use to stimulate the lining. Not only does it improve their quality of life in terms of bladder function, but it also helps them with the intimate process with their husband. That's catching on very, very fast. And apart from the surgical liposuction, which is a minimally invasive procedure, we make small holes, get under the skin into the fat, and we are able to pull the fat out, and the healing goes on. That's part of the body sculpting. There are people who have frown lines in their face, to the extent that when they're not angry, you look at them, they look like they're angry.
Right.
So those are things we use, like it's called Botox. There's Botox, there's Dysport, they're liquid medication that we inject to relax the muscles.
Right.
And once we relax the muscles, they don't appear that they're angry anymore,
Interesting.
Yeah. Now there is another technology which we use called cool sculpting.
What's that? Cool sculpting.
Glad you asked. Cool sculpting, it's no cutting. It's body enhancing device. That is, it uses cold or ice.
So when you say no sculpting, you literally don't need a scalpel?
No.
You don't cut any part of the body?
No.
Well, that's kind of cool.
Yes, that's why they call it cool sculpting. And it uses cold. And so this technology was developed by MIT laser scientists, Ross Anderson and his team in Harvard Medical School. They developed this technology. And essentially what it does is you apply it to an area, and it pulls the fat into a little cup, and it cools it down to a certain temperature. And that's, all the science shows, what happens after that. And, once it cools the skin down, the fat dies.
Okay.
The fat cells will die. And
so,
then,
assuming I go through a cool sculpting procedure,
yes.
Once it's complete, how long does it take for me to heal my body?
Technically, you have about a week but it's not a week of downtime, but you see results in 2 weeks, in the sense that now you see that area of bulge going down. So you may need to do maybe 2 or 3 sessions, 2 or 3 weeks apart.
Right.
And then there's no cutting. So once it's done, it's usually 35 minutes.
How long has CoolSculpting been in existence?
I would say about 6 to 8 years, and it's a well-kept secret.
I never heard of it.
Yes, yes, it's a well-kept secret because it's the beauty secret actually for a lot of people, and the reason it is that people will just sneak out, go and get the procedure done lunchtime, and they go back to work, and you ask them, they didn't get any cutting anywhere, but after 2 weeks, maybe they do 3-4 sessions. After that, you see a major change,
right?
And you wonder what happened to them,
right?
But that's the beauty secret,
right? That's interesting. Well, thanks for sharing.
It's very popular. CoolSculpting has its limits in terms of how much it can sculpt your body. So the patients who come in, and they come in for CoolSculpting because CoolSculpting has a lot of direct consumer advertising. It's on social media, so people hear about it and they come in. So when they come in, I evaluate them and determine, look, do you need CoolSculpting or you need liposuction? So some people are just afraid of just even a small cut on their skin. So okay, CoolSculpting is what you need. We offer you that, and we give you an expectation or what you're is going to look like when it's done, and if that's what you want, and you go for it. Now the people who come, and after I show them before and after pictures, they say, well, I think liposuction is what I want, because I don't want to get cut, but I think this is what's going to, based on what you have shown me, this is how what I'm actually looking for.
Right.
And so we separate the two people, or the two groups of people, so that we give to each whatever they need.
Right.
So that's how we're changing the world around here.
You've elaborated pretty much on CoolSculpting.
Yeah.
Now, people hear liposuction and they have an idea of what it might be in their mind. Let's hear it from the horse's own mouth, from an expert. What is liposuction? Demystify it.
Oh yes, liposuction really, it's a procedure where we take the fat out and allow the skin to heal on top of the muscle, so that it takes away the bulges or difficult areas of fat. So,
and it's done surgically by cutting?
Yes. So we do a lot of liposuction in the outpatient, and after we've assessed the patient, we see that they have a very minimal risk factors. We decide, okay, for the amount of fat we're going to take out, we probably can do it in the office. Nice setup, and we go through, follow all the surgical protocols to achieve that. And so what it entails is that there are essentially different devices that we use. The most popular one actually is called Micro-Air. Micro-Air has a low, tiny 2 millimeter, 3 millimeter tube, and some can go up to 4 or 5 millimeters in terms of diameter.
Right.
And so we numb the area, make a small incision. That's the size like the lead of a pencil.
Right.
And we introduce a cocktail of fluid that into the fat layer, and we wait for about half an hour, and it numbs the fat area. Meanwhile, we give the patient some medicine to relax them, and sometimes we may have to give them something for pain.
Right.
Ahead of time.
Right. And all this procedure, is it pre or post anesthesia state, or there's no anesthesia involved?
Well,
Or it depends?
if it's being performed in the operating room, then there's anesthesia, general anesthesia.
Right.
If it's being performed in the office or outpatient, they call them certified procedure rooms, then we don't put them to sleep.
Okay.
They're breathing on their own.
Right.
But they're being monitored in terms of their vital signs, blood pressure, their breathing. They call something SpO2, that's the amount of oxygen. And then we also put a tube, just a little thing in the nose, in the nostrils, so that we can measure the amount of carbon dioxide that they're producing. So it's just the monitoring process.
Right.
So we make sure that everything is safe.
Right.
And we also would put leads on their chest to monitor their heart rhythm. So these are all things we do, make sure that it's safe, everything, there's no problem.
Right.
Then we introduce the solution or the cocktail to numb the areas that we need to perform liposuction. Wait for a little bit, and then we go ahead and put the 3 millimeter or 2 millimeter cannula in there, connected to a device. And basically, this device, the micro air, what it does is that it moves at 50 cycles per minute. So it goes back and forth, and in the process, it has some openings at the tip that is actually sucking the fat. So they call it power assisted. So the power assisted means is that the machine just vibrates, and in the process of vibrating and suction, there's a suction machine there, so it vibrates and sucks the fat.
Right.
And so when it's all done, then all the fat is gone. And so you see there's a layer here, there's the skin, and then the fascia and the muscle underneath. So basically what it is that once that's done, everything lines up, the healing process goes, the fat is reduced to the point where it's safe, and then they wear a garment at least for 2 weeks, to make sure that healing takes place properly. Now, the garment could be like a binder, or sometimes there's some garments, they call them body magic. It's like an elastic garment, like a corset that they wear. Okay, so that is the process. Now, this is where there's a difference between somebody who just comes in, learns to do liposuction, and somebody who has an eye for beauty and is able to do body sculpting. Because what happens is that in cosmetic surgery and liposuction, it is not what you take out, but what you leave behind. If you leave too little, you've gone too far. If you leave too much, you haven't completed your job. So you have to have the eye to be able to even get the patient to stand in the process and look at them and see how much you have taken, the curve you're trying to create, the symmetry that is going to be behind when you are done. So those are the fine nuances that determine your experience and your eye for beauty. So that really is the difference between one cosmetic surgeon and another, because at the end of the day, like I said, it's not what you take out, it's what you leave behind.
That's interesting. That's a pretty elaborate explanation. So, what's the difference between a cosmetic surgeon and a plastic surgeon?
All right.
Briefly.
Anybody who's a doctor and has some surgical experience can become a cosmetic surgeon. And basically, they just need to go for courses and understand what it takes. And more often than not, most cosmetic surgeons will focus on certain areas, because see, cosmetic surgery is not about correcting any problem. It's about enhancing the appearance. So most people coming for cosmetic surgery are not sick.
Right.
Unlike plastic surgery, plastics and reconstructive surgery really is fixing stuff. Someone gets a dog bite and they have a big cut, somewhere, they need a plastic surgeon. Someone gets involved in a motor vehicle accident, they have cuts in their face, on the skin, they need plastic surgery. Someone was born with a congenital deformity, they need a plastic surgeon. But some plastic surgeons also move ahead and become cosmetic surgeons, because one of the other differences is that most plastic surgery procedures are covered by insurance.
Right.
But almost all cosmetic surgery procedures are self-pay. So if you can't get good outcomes, patients will stop coming to you.
Right.
So if you go and hang your shingle as a cosmetic surgeon and you're not doing stuff that the patients want, you're not going to get business.
Right.
Because they pay their hard-earned money. And once someone is paying hard-earned money, they want to see results. They want to make sure that
they're getting their money's worth.
Exactly. So that's really the difference. As for plastic surgeon, once the insurance approves you and says, okay, this person can take my insurance, just like most doctors, they're going to come to you.
You have a practice in Ghana as well.
Yes, I do.
Tell us a little bit about that practice and how long it's been in existence.
Oh, the Ghana practice is called Center for Cosmetic Surgery Ghana. It's located in the airport residential area. It's about probably 10 minutes from the airport. And over in Ghana, we focus on essentially the same things we do in the US. The practice is set up such that it attracts people from West Africa. We get patients all the way from Cameroon through Nigeria down to Guinea-Bissau. They come all the way from West Africa. And I go to Ghana 4 times a year. I stay about 2 weeks at a time. I have a partner in Ghana who's a plastic surgeon, but never got trained. I mean, he didn't get his training as a cosmetic surgeon.
Right.
But we work together because he is he's very knowledgeable, and so we work together. Because we try to get the best outcome for the patients.
Right. Right.
And we pretty much see all kinds of people, and we get outstanding results there too. To the extent that we have become the main center for cosmetic surgery for West Africa.
That's interesting.
Yes.
That's interesting. Now, this program, of course, is called The African Dream. When you look at what you do and you consider the fact that you're originally from Ghana and West Africa, briefly tell us, where do you see yourself going with this in the future as far as the African continent is concerned?
Well, that's a good question, and I really have thought about all of that, and Africa is a very big continent, and there's so many people who have needs. And for cosmetic surgery, as we had talked about before, it's cash, and cash is king. If you don't have cash, it's very difficult. Even though one may have a need. But it's still enhancing beauty. So we started the Center for Cosmetic Surgery as just a purely for-profit business. But just because of the need that I see in people, I'm beginning to add the non-for-profit portion to the Center for Cosmetic Surgery, so we can provide services for people on a sliding fee schedule.
Right.
That is in the works right now. We really haven't started it yet because we still need to put everything in place and be able to solicit some funding for people who are in that category. And one of the categories we've been looking at really is breast reconstruction and cosmetic procedures for breast for people who have had breast cancer and have received treatment. So that is one area that we're looking at, where we will work with patients who initially after breast cancer surgery, a lot of them will have prosthesis. That is, they put a foam or something in their breast just to external appearance, make it look nice.
Right.
But they eventually some of them will need extensive surgery, and even though that is reconstructing, that's mainly part of plastic surgery, but there's some cosmetic component to it that, because I have a partner who's a plastic surgeon, we work together.
Right.
We plan to work together and put it all together very well. Now, then the next area is really to enhance it and bring more people from the different West African countries. I don't think we plan to go outside of West Africa, because it's a big continent, like I said.
Right. Well, it's been a pleasure having you here on the African Dream, Dr. Kwesi Deborah. We look forward to coming back again and finishing this conversation, because there's a whole lot to cosmetic surgery that we feel like people really need to know about. And you seem to be a willing partner to share, and we appreciate your time and your expertise a lot. We really do.
Thank you very much, Oral. And I really enjoyed this discussion, and I look forward to another opportunity to take this conversation to the next level.
Interesting.
Thank you so much.
Folks, you've been watching The African Dream. I'm Oral Ofori, and today I was here with Dr. Kwesi Deborah. He's a cosmetic surgeon. He has a practice out here in Bowie, Maryland in the USA, and in Accra, the capital city of Ghana. We're going to come back and continue this conversation where we're leaving off. But while you wait for us to return, if you want to get in touch with Dr. Kwesi Deborah, his address is right there on the screen. As you can see, the email address for his Ghanaian practice website and his Bowie, Maryland website is also on the screen. Respective phone numbers are also there on the screen, and so we'll encourage you to get in touch personally, and if you have questions, he would be glad to give you responses. And we're out here in his outfit, and you can see while the interview was ongoing that he's got a pretty neat and decent place out here. So we encourage you, whether you want to check him out in Ghana or out here in the USA, go out there and do that, and tell him the African Dream sent you. Thanks for watching, and thanks for being here with us, Dr. Deborah.
Thank you so much. Okay, my pleasure.
All right.
All right. Cool.
That's my boo from the west side. No need to test side. She come through anytime, side. She like me cause I make sure they come, side. Every day, all day. We dey rock this world like Bob and we should understand the meaning of loyalty. She keep it 100 all day. I bet you know that. That's what a soldier needs. So I try to provide the needs. They wanna run down, she dey run things. Because of that, step under the fear.
Yo, who go stay? Girl who will never play. I'm looking for a girl who go pray. Not about decay. Girl who is here to stay. As independent as you are, you be my star. Feminine like a star. Yo, ni a chose jopa. Kebo baya.